Today, we're going to talk about treatment, complications, and the long-term symptoms of COVID. I'm sure you all have heard of long COVID, so we'll touch base on that a little bit this time too, and kind of delve into a little bit more of the nitty-gritty as to what COVID entails. The thing that makes it such a unique virus and such a different infection than other viruses we've dealt with is the fact that it's one a myriad of different kinds of viruses that you can get. So there are many different strains of COVID that you can get, and that in turn leads to such a wide variety of symptoms. And because this is all experimental, I remember when COVID was first happening and I was in med school, is there going to be a treatment? What can we try? And everybody was figuring everything out. So it's constantly, because it's also still such a new virus, there's always changes being made to treatment. So I want to just preface by saying that make sure, again, you're getting your information from a reliable source. The CDC is great. Any medical journal is great. Sometimes the WhatsApp chats and the Facebook chats are not, but always, if you're going to take a treatment, talk to your PCP, your primary care provider, any healthcare professional, because treatment options are changing constantly and the types of treatment are changing constantly. But that being said, just to start off with, when do you need to escalate it? When is it a problem? When does it progress from just being, oh, the common cold and I should just drink some chicken corn soup, to being, oh, maybe I need to go see somebody and get more aggressive treatment? So the first phase of COVID is very similar to any common cold that we've had or any virus that we've had. It's the, oh, I feel a little bit down, my head is hurting, might have a cough. Some people have stomach problems. You could have diarrhea, you could have constipation, you could have a cough, you could have no cough. Oftentimes, what's prevalent with all the infections is that common feeling of myalgia, which just means weakness. So just kind of feeling down. I've heard so many patients say, I don't feel like myself. Like, not feeling like yourself could be COVID, but it could also be so many other things. So that's where testing becomes such a big part of this whole thing and why testing is so important. But when you have the initial findings of the illness, when you're just kind of flu-like symptoms and you say you get tested and say you test positive, if you test positive, then that's the viral phase of infection. So during that viral phase of infection, you can give treatments such as remdesivir, you can give convalescent plasma, you can give monoclonal antibodies, and we'll talk about when those treatments are indicated. But in that initial phase of infection, before it gets really bad, those are the treatments that are commonly recommended. And all it's saying with lab findings is lymphopenia, is just your white blood cell counts might look a little bit off. So if it gets to a point where you're really not feeling good and your doctor makes you get lab work done, then based on your lab work, they can look at it too. If you look at the testing, something that I thought was really interesting was you can have symptoms starting earlier and you can test negative. And if you test later on, you can test positive. So if you have symptoms and you're starting to develop this cough, cold-like symptoms and you test negative, it's a good idea to maybe test again in a few days. You might not have the viral load yet. And so if you look over here, symptom onsets on day 0, but you're not testing positive until day 2, which is crazy. Now, if the infection progresses, the symptoms that you'll start to experience where you should be concerned and maybe think, hey, I might need to seek further treatment, is when you start to get short of breath. That's the biggest thing. Protecting your airway and making sure that you're able to breathe is so important. And I don't know if you've ever seen like a chest x-ray, but for COVID, the ground glass opacities is what they call it. But it's basically all these little dots on a chest x-ray, and COVID attacks your lungs. It loves your lungs, but it infiltrates in there and it grows in there. And so when you're infected, it influences your breathing. And so when you start to become short of breath, I know when I had COVID, I'm a runner and I couldn't even walk up a hill and I'd be panting. And I was like, Mom, why do I feel like this? And then lo and behold, I had COVID. Once you start to get that short of breath, and if you have one of those pulse oxes at home and you use that and you notice your pulse ox start to drop, or even like an Apple Watch, you can tell your pulse ox on an Apple Watch. And if you are starting to feel short of breath, might be a good idea just to check your pulse ox and see where you're at. In that stage, you're a little bit more infected. And so you've had a viral load that's continuing to grow. And then you might get steroid treatment, which is dexamethasone. So that's commonly what they'll treat it with in the hospital. You might have to go get seen, and if they decide to admit you to do further treatment and testing and monitoring, that's kind of what we're looking at. Now, the problem with COVID is we don't want to get you to a point where you need mechanical ventilation. You want to prevent that. So that's why they'll do the steroid treatment, and they'll notice it that it's getting worse through elevated inflammatory markers, because COVID causes this excess inflammation. So that's kind of the stage 2 of the disease. In terms of stage 3, that's the thromboinflammatory phase. So that's when it goes beyond just causing inflammation in your lungs and affecting your lungs. Now it's affecting your whole body, and you're getting this wide immunoresponse that's kind of this inflammatory response. Your body's kind of going into whack in simple terms, but that's where you get like your lab findings will be all abnormal, and you'll get severe D-dimer elevations. You can have multiple organ failure. So COVID will affect many different organs in your body. And that's where we get really concerned about your risk for like a pulmonary embolism going up, or for having myocarditis, which is this infection around your heart, or for going into shock. So that's when you definitely will need to be hospitalized and to be closely. And at that point, anticoagulation is the treatment. But before we get there, there's many things before we get there. So this is kind of the stuff that we can do to prevent anybody from getting there. And this is where we talk about treatment options. So there's a couple of different treatment options, but these are the most common and these are the most widely available. There's Paxlovid, which is an antiviral. We'll talk a little bit more about that in detail because I think that's the most common. But people who are at risk of getting sick are adults, obviously, and anybody's at risk of getting sick. Kids that are under the age of 12 have an increased risk of getting sick. And for Paxlovid, you can take this at home by mouth orally, which is great because it's a medication that you can go get prescribed and you don't have to remain inpatient in a hospital. And you can start it as soon as possible, but it's got to be within 5 days from symptom onset. So if your symptoms started, my symptoms started last week, Monday, and I'm coming to my doctor and now it's Tuesday of the next week, it's too late to start Paxlovid and it's not going to be effective. So they're not going to give it to you. So that's why it's important to test early, find out what you have early, and treat early so that we can prevent future complications. So that's Paxlovid. Next is remdesivir. Remdesivir is also an antiviral. So these antiviral drugs really target the virus and they have to be started as soon as possible because before there's too much virus in your body where these medications are not effective, you want to give these medications because they help inhibit and they help stop the replication of the virus. So they help keep the virus at bay. So remdesivir is another really common one. You want to start it as soon as possible, but you can start it within 7 days of symptom onset. And remdesivir, the one thing is that it's IV. And so you get it at a healthcare facility for 3 consecutive days. Depending on where you are and how it's available to you determines how you can receive the IV form of remdesivir. The last one that's commonly used is molnupiravir, and that you need to also start within 5 days of symptoms starting, and that you can also take at home orally. And again, these are just 3 of the most commonly used ones. This is what the CDC has. But one thing that's really cool is that there's something called sites that the CDC has and that the government has set up where you can get tested and treated. So sites like that will enable you to get remdesivir treatment at those sites, and you can get tested and you can get treated right away because we want to catch it early, stop it early, prevention. We don't want the disease to progress. And it's hard to get to a facility. So if you're going there and you get tested there and then you end up needing treatment, you can do it all in one go. But Paxlovid. So Paxlovid is one of the most commonly used ones. It started to gain prevalence because it had such a high effectiveness at reducing hospitalization. Again, needs to be started within 5 days of symptoms, and it can be given to individuals who are pregnant, which is always a good thing to know that even during pregnancy, you do have options before you're taking any medication. That's why it's so important to not just take anybody's pills that are in the house, but to make sure that you're getting prescribed the medication by somebody who can look at your other comorbidities as well. So if you have severe renal or hepatic or liver problems, you're not recommended Paxlovid. Interestingly enough, in the beginning, like getting Paxlovid was so hard, whereas now about 35% of people who get a positive COVID test end up taking Paxlovid. And it's currently our most effective tool for preventing outcomes such as hospitalization and death in COVID patients. In terms of recommendations, it's recommended for anybody who's 12 years and older, and you have to weigh above at least 88 pounds, anyone who has a higher risk of COVID progression. So if you are diabetic or you have heart problems, you're on any immunosuppressants, if you have any risk factors, then you receive these treatments.
The last time that I got COVID, I think it felt like the most sort of serious, like it felt more intense than the times I had gotten it before. And that was the first time that I had access to Paxlovid that I knew about. And I did telehealth and got it. I'm really glad I did because I don't want to know what it would have been like otherwise. And also just the idea of long COVID for me is not something that I want to mess around with at all. So anything that can, help combat that is, I was very, very happy to have access to that. Sometimes if you are somebody who's been diagnosed with mental illness, if you have depression or something like that, that can make you qualify too. So it's always worth finding out if you qualify, even if you don't think like, oh, I don't have diabetes or I don't have heart disease, it's worth looking up what can make you qualify.
Yeah, I think they have pretty broad broad who can qualify. So definitely if you have any like heart disease, diabetes, any like HIV, you 100% need to take it. And for kind of, if you've had COVID before and it's been mild before and you're like fully vaccinated, then it's kind of up to you and your discretion of like, if you do want to take it, just knowing that COVID is like such a big risk. And especially if you're unvaccinated, you should also definitely take Paxlovid. My experience with Paxlovid was good. It like made it go away like within a week, I think, total. The only thing that's like to be aware of with Paxlovid that like I experienced, that many patients I've had experience, is like this bitter taste that comes with it sometimes.
And that was
So
kind of weird, but not
yeah, so
so bad.
if you're
Yeah.
a little uncomfortable, it's like an uncomfortable thing. But as many of you guys know, a lot of health things and health things that we should be taking are not the most comfortable, but just have to reinforce and remember that it's for your health, has a good impact overall.
I will take that weird bitter taste over extended COVID symptoms any day. Any day.
Exactly.
Yeah.
Initially, I was involved in a lot of COVID research for drug treatments, and I was at Northwell, and they did a lot of research into immunotherapies for COVID. And the way that we would see what drugs are effective is by testing, or even picking subjects to work with, was testing the antibody levels in the patient to see which patients produced more antibodies and to see which ones had been infected and come out of it okay, or like lived to tell the tale. And they were testing antibodies of patients that had also been hospitalized. And so while that was there, it was also shown that there were people that were infected, but it also matters on the amount that you're infected, because you might not have mounted that big of an immune response. So me and Mega could have both gotten COVID, but Mega's antibodies could be really high and my antibodies could not be that high. And so how do you tell? I might test negative for the antibodies, but I also did get COVID, and Mega might test positive, but she like might have tested positive for the amount of antibodies you need to say, hey, she had COVID. So it's not
So
like
it's not like a reliable.
Yeah.
Like for certain viruses and for certain antibodies, each thing is kind of different that we make in our bodies. So some of them may fade over time, which is why we need another vaccine. So our bodies, just because it's faced a virus, a lot of times our immune system will build an antibody against it. But for things like COVID, they found that it's not necessarily that even if you've had it 2 years ago, that your body has any sort of immune response to it necessarily. Just to keep in mind, which is why we always got to keep getting our updated vaccines.
One thing to highlight there too is just prevention. You can prevent so much progression of disease and prevent so many negative outcomes and long COVID, and by doing the vaccines, doing the hand washing, like it comes in tiers. So first step is hand washing, mask wearing, being protective, not being exposed in large environments, not drinking a random water cup you found on the table. Then the second thing is making sure that you're vaccinated, making sure that you're up to date with your vaccines and that you're following all guidelines. And if there's like a COVID hot area, you're maybe not in it. And then after that, it's okay, I feel sick. Now I got tested, I get treated. So I prevent progression of the disease. So prevention is the way to go. One thing that's interesting is COVID-19 rebound. So sometimes what happens is that after you've recovered from the initial illness and you think, oh, I'm good now, I'm all fine. But then you get sick again and you're like, wait, what's happening? Did this not work? Am I getting long COVID? Is this something serious? So it's called a COVID-19 rebound, and it happens in approximately like 35 to 40% of people. But it's the return of symptoms, and you can have a new positive test. You could have even tested negative initially, and then you could have gotten worse, gotten sick, or gotten treated, and then retest positive like a week later. You can experience this rebound whether or not you get treated or not. But rebound symptoms, the good thing is they're typically mild. The sickness that you get from getting the vaccine is so much less than the sickness you get from getting the actual virus. And that's kind of like the rebound phase. The rebound phase is less than the virus, so not to be super alarmed, but there's no increased risk of severe. The one good thing to know is that if you're like, oh my gosh, I got sick, got Paxlovid, I got a little bit sick a week later, it's good to note that there's no increased risk of developing severe COVID illness. That doesn't have any like prognostic factors. And so the benefits of COVID-19 treatment really outweigh the risks of rebound. Because some people, while they're on the Paxlovid and they've then finished a course of Paxlovid, are like, oh, I feel worse again after I'm done. Whether or not you took the treatment, you can still feel worse a little bit like a week later. You know what I mean? And so that's why it's really important to get treated and to not be scared about getting treatment, and talk to your PCP if you're concerned about rebound. And again, we talked about these test to treat locations. To get everything done at one location is phenomenal. And so if you're uninsured, have have Medicare, Medicaid, or VA insurance. Honestly, the ability to get it is so broad. So many people can get the free access to the COVID-19, and you can get flu testing at these locations. They also can do telehealth if you're unable to get to the location, and it's called the Home Test to Treat program. So if you just type it in on Google, it'll come up with a CDC website, and you can just type in your zip code. It'll show you pharmacies that have the medication that you're looking for, and it'll connect you with providers who can prescribe the medication. And they have interpreters. So it's trying to increase accessibility to testing, to treatment, and to follow up with healthcare professionals.